Hello, I'm Dr. Anthony Tarescavage, licensed clinical psychologist, associate professor of psychology at John Carroll University, and owner of Cleveland Psychological Testing. In this video, I'm briefly going to review some of the most important points from the International Association of Chiefs of Police guidelines for pre-employment psychological evaluations. Briefly, the way that this video will be conducted is I'll have on the screen some of the most important guidelines directly from the IACP document, and then I'm going to highlight some of the most important pieces of information. I'm going to go through this quickly for the sake of time. You can always pause the screen to read the guidelines in more detail, and also at the end of the video I'll have a link to the full set of guidelines. Starting first with the purpose of these guidelines, they are basically they outline the most defensible way to conduct pre-employment psychological evaluations for public safety agencies. This is important not only to ensure the highest level of public safety, but also in the case where an officer or a public safety individual acts in an irresponsible or inappropriate manner. This sort of process shields the agency from legal liability because it illustrates what the best practices are for conducting these evaluations. Some important definitions here are that in most jurisdictions, typically what you're looking for in a pre-employment screening is, one, that the candidate does not have a mental health disorder, and two, that they're able to withstand the psychological demands of a position, for example, being able to manage stress appropriately and to be able to interact with other individuals, citizens, etc. appropriately. Importantly, medical information is not allowed to be used in hiring decisions, and that's because of the Americans with Disabilities Act. So for that reason, the pre-employment psychological evaluation has to be conducted after an offer is given, because the psychological evaluation is considered medical information. In terms of examiner qualifications, the IACP says that these evaluations should be conducted by licensed doctoral level psychologists, ideally. Also, the psychologists should have expertise in clinical assessment. In other words, they should have training in how to diagnose mental disorders. This is important for two reasons. First of all, some doctoral level psychologists conduct these evaluations, but they do not have this training. For example, industrial organizational psychologists do earn a doctoral degree. They are doctors. However, their training is in selecting the best candidates for businesses, not in diagnosing mental disorders. In contrast, a licensed clinical psychologist, they're specifically trained in diagnosing mental disorders. Another type of professional who does these evaluations are master's level clinicians who only have a master's degree. If they have a master's degree, that means they have less than half the training in psychology, and very little of that training is focused on clinical assessment. So also a master's level clinician would not fit with the IACP guidelines for examiner qualifications. Furthermore, the IACP notes that the examiner should be specifically trained in pre-employment evaluations for public safety positions. And they should also be familiar with the research literature available on psychological testing for public safety positions. So to summarize, the ideal examiner qualifications are a licensed clinical psychologist who has training in pre-employment psychological screening and who also is familiar with the research base in this area. Section 5 indicates the need for a job analysis. Essentially, the agency who's hiring the candidate should have a description of the job duties that candidate will need to complete. That description should be given to the evaluator so that they can assess whether or not the individual can complete those duties. Testing is outlined in Section 7, and it notes that a written psychological test battery should be administered to every candidate. Also in Section 7, it notes that the results of that test battery should be reviewed by the examiner before the interview is conducted. That's because the purpose, one of the major purposes of the evaluation of the interview is to follow up on potential concerns that were raised by that psychological testing. In conducting that interview with the candidate, typically it's given face-to-face. The psychologist essentially evaluates if the individual has a mental health condition that would interfere with their ability to complete the essential duties of the position. They also follow up on psychological test information and background information that potentially raises concerns to clarify if those are going to be issues on the job. Although face-to-face evaluations are typically what's conducted, the IACP does note that electronic or telehealth evaluations are appropriate as well. In terms of reports, the IACP notes that the reports should go to people who are directly involved in making the hiring decisions. This is to help protect the candidate's privacy. Also, that report should include an analysis of all of the psychological information that was collected, including background information about the candidate's history, the test data, as well as the interview information. And the conclusions that the evaluator makes should be based upon consistencies across data sources. So this is similar to the logic that you might follow in an investigation, right? Certainly, I would imagine if conducting an investigation, you wouldn't want to rely just on one witness's account. For example, you would want to gather a lot of information from different sources to get the most reliable understanding of what happened. Same sort of logic applies to psychological evaluations of police officers and other public safety positions. Multiple sources of information, testing the candidate's behavior, their background, all of that needs to be considered to arrive at a conclusion. So those are some of the highlights of the IACP guidelines, and I'm going to leave you with 8 questions to ask about your current evaluation process. First of all, are your evaluations conducted after conditional offer of an employment has been made to the candidate? That's what's indicated in Guideline 3.3. Second, are your evaluations conducted by licensed clinical psychologists trained in identifying mental disorders? Third, are your evaluations conducted by psychologists specifically trained in completing pre-hire psychological evaluations of public safety officers? Fourth, are your evaluations conducted by psychologists who are up to date with the research literature on psychological testing with police officers? Fifth, have you provided your evaluators with a job description for the individuals that they are evaluating? Sixth, are your evaluators reviewing the test results before they go into the interview so they can clarify the test results? 7, are the reports that they complete only going to someone who's directly involved with the hiring decisions to help protect the candidate's privacy? And finally, are your evaluations based on multiple sources of information, such as interview, background information, and testing to arrive at a conclusion? I'm going to suggest that if the answer is no to any of those questions, that of course the logical next step is to attempt to fix that issue with your current evaluation process so that it's consistent with the IACP guidelines. Another thing to consider is a new evaluation process and perhaps a new evaluator. Now, in some cases that's difficult. Maybe there aren't a lot of options near you for these evaluations, and that's where you might consider remote psychological testing via technology and the internet. And this is appropriate according to the IACP guidelines, and it would open you up to access basically evaluators all across the state who are licensed in that state, who could then complete these evaluations in a way that's defensible and consistent with the IACP guidelines. If you have any other questions, feel free to contact me. Again, my name is Dr. Tarescavage, owner of Cleveland Psychological Testing. If you'd like to get further information on the IACP guidelines, the link at the bottom of the screen will bring you the full guidelines. Thank you for your time and have an excellent day.